All right, I'm Connor Hatch, and this is my field experience overview for the spring of 2025. So for this semester, I was at Providence, Newburgh as a constant observer in the emergency department. I observed at-risk patients who were at risk for either harming themselves or others, and I communicated with nurses on shift during my time observing about any behaviors that these patients were doing that were considered risk or maybe harming themselves or at potential to harm themselves or others. So my goals throughout this semester were to grow in my competence recognizing abnormal behavior and thought processes along with mental health situations. I was able to observe a lot of different people with a lot of different situations and different mental health problems that they were coming in for. I was able to learn, and my other goals were learning more about the clinical side of psychology. I feel like I was able to do this through just being able to observe and be in the same uh, vicinity as people who are struggling with mental health and struggling to the point of needing to come into the hospital. Also, to grow my professional communication, I spent a lot of time communicating with the nurses on staff, really trying to let them know about what was happening, what I was observing, and making sure that they're uh, being utilized when they were needing to be utilized. And then experience working in a hospital setting, this was definitely something that was interesting and new for me and it's provided a lot of experience going forward. Related to coursework, so definitely related to counseling course, I was able to observe a lot of nurses talking with the patients, really listening to their problems, and I was able to talk with patients myself at times, really just listening to what they're trying to say and focusing on using those listening skills we learned in the counseling course on how to actively listen and really feel like these be empathetic to people they're talking to, especially in the situation that they're in. They really need that. So also saw this relate to adolescent development. There are a lot of younger patients at times in the ED, which was interesting to know all the research that we've looked at in that course on what causes mental health or some factors leading to mental health crises in adolescents, as well as how these adolescents interacted with their parents and their parents interacted with them while they're in the hospital, and how maybe that uh, and how that either helped them or maybe even brought them down more, depending on their relationship with their parents. So influence of faith, definitely being in a hospital setting, it is a little more of a secular environment. Of course, there's a lot of Christian influences. There's always like they do the 8 p.m. prayer and different prayers at night. But largely, not a lot of people there are Christian or seem like they're Christian. For me, I was really just making sure that I bring a good attitude to my work and to what I'm doing. There's a lot of times that the nurses don't have the greatest attitude. Now it's interesting to see at times, and really being someone who has a good attitude in that space is probably could be a good thing. Yeah, and there's one time there's a patient who was adamantly against Christianity and against Christians, and they were talking about that as part of what they're brought in for was aggressiveness and why they were, but they're also pointing out aggressiveness towards Christians and how they were in their words. So it's definitely a little hard to hear, but something I needed to just take and really have a certain heart of knowing that this person is struggling, that they're going through something, that to not take it personally and to know that, and to have just to be strong in my faith in that way. So going out past the experience and my continuation in psychology, so learned a lot about what it looks like to learn to work one-on-one with patients in these situations, just from observing the clinical students and psychologists who come in and talk to the patients as well as the nurses, and learn more about what these one-on-one looks like. And I want to work with adolescents in the future, so getting to see somehow nurses and some of the psychologists interacted with adolescents was beneficial to me. And I'm still considering counseling as a career and have experience really help me get more experience in the clinical setting and give more insight to people I may encounter as a counselor. So overall, I learned a lot from my field experience this semester as a constant observer. And the nurses that I worked with were professional and competent in their jobs. That really helped me to remain calm in stressful situations, which happen at times and pretty chaotic in the hospital sometimes. But it was good to have competent workers and people I could trust around me. And I'm just thankful for the opportunity that I received to work at Providence Newburgh and to be a constant observer this semester.